I'm Shanti. I'm going to for all the viewers where we should enter this participant. Topic for today's webinar is medicine heals for kids. Sponsor for this topic of webinar is Sister Tulika Das. Sister Tulika Das ji retired from a very reputed college of Calcutta. She was a faculty and now she is working as a full-time spiritual counselor and has been attending several webinars for more than one and a half year. She is having a degree in PhD house management. And she has completed a MS in counseling and spiritual work, and now she is practicing as a spiritual counselor. With her today's as counseling is Sir Rafti Mehraji. Sir Rafti Mehraji is a professional teacher. She is also an entrepreneur and practicing as a spiritual counselor now for 1.5 years, very successfully. Then last but not least, we have Sister Vishali. Sister Vishali is holding a technology and also spiritual counselor. So this is a demo counseling by the presence or the student of counseling and spiritual health. So today's live on YouTube as well as Facebook. We accept any kind of mental health related counseling. You can reach to us at free counseling from the website like www.futureseer.com. Also, we can get the 931. So we start today's webinar with the remembrance of Shiva, who is our Supreme Father, Supreme Teacher, Supreme Sadguru, and we also seek the blessings from our most of the and brothers and sisters. So we are thankful to all our viewers for being with us at the YouTube. Now I request Sister to start today's session.
Om Shanti. Good evening, everybody. Welcome to our demo counseling session on medicine heals or kills. Heart disease is the leading cause of deaths in India, both across rural and urban population. Next comes cancer, with prescription drugs being the third leading cause of death. Although some medicines require a prescription, others are available in stores. We can buy many medicines for pain, fever, cough, or allergies without a prescription. But just because a medicine is available over the counter, that does not mean it's free of side effects. Today's medicines are very complex, and the dosages tend to be precisely prescribed for each person's needs. Either underdosing or overdosing can be harmful. So when we follow the doctor's instructions and take medicines in the right way, at the right time, in the right amount, medicines heal us. But if used randomly, it may lead to death. So with the blessings of our Supreme Teacher, Supreme Counselor, and Supreme Doctor, Parampita Paramatma, we shall start today's session. Good evening, Sister Vaishali. How can I help you?
Good evening, ma'am. My younger sister Rakhi had the gallstone. The operation 3 weeks ago. Before the operation, routine test showed that her blood sugar was the high. Doctor gave her the medicine, but last week she took the overdose of medicine and feel ill. I called the doctor he was the very agree. He said he will not take any responsibility in the future. Raki has the habit of taking excess medicine from young age. My friend suggested that I take your advice, so I am here today.
Okay. Has your sister come with you?
Yes, ma'am.
So please call her then.
Rakhi sister, please come.
Uh, Hello, ma'am. Namaste.
Good evening, sister. Sister Vaishali is very much concerned about your health, and you're really fortunate to have such a caring sister, isn't
Yes,
it?
she loves me a lot now, and she cares me.
So now please tell me something about yourself, about your educational qualification, and what you are doing at present.
Uh, at present, first of all, I have completed my post graduation in geology, and since then have done PhD, and I am teaching in a college since 5 years ago.
Yes, okay. Is your college near your house?
No, ma'am, it is far away. Uh, just कि when I go to for the college, I take auto for 10 minutes to it reach me to the station. Then I catch the train. It took 1 hour. Then I again take an auto for 10 minutes. So then I reach my college.
Okay. So when do you leave home then?
Um, uh, I leave home at 9 o'clock and return at 7 p.m.
You go there every day?
No, ma'am. 5 days in a week, I go to college.
See, your elder sister told me that you had gallstone operation recently. This means you are on leave.
Yes, yes.
Okay. Then, what happened? Lately, she told me the doctor was angry with you. What happened actually?
Uh, this is my carelessness, I told you the whole story, na. जैसे कि I took 2 weeks leave, and but after 10 days, I felt that I found that my stitches was not drying. So I tested my sugar level with the monitor at home. So uh, when I see this, madam, what I told you, it was slightly high. I have so much work pending at my college, so much theory practical classes. I must correct the examination sheet scripts. So it is not possible for me to attend the attend extend my leave.
Okay.
I take more leave, so I can't stay at home. I don't like to sit in a, ill. So I decided to took the double dose of sugar medicine.
Then what happened then?
Oh, what I told you. When I take this, I was profusely sweating. My whole body was sweating. My hands, legs were cold, and I could not stand properly. I lay down on the bed, and I couldn't see properly. Then I call my sister. Please give me the water of sugar and two with 2 spoon of sugar, and then I take 3 glasses of water with sugar, and then my temperature was become normal, and my sweating then stopped.
Okay. So what about your sugar level? Did you check it? Did you
Uh,
check your sugar level?
No, I didn't check this, but my sister scared and called the doctor. And what I said to you, he was very angry with me, and he told me, if you couldn't follow my instructions, I could not take your responsibility in the future. He but he angry words uses. What I say to you?
Okay, see, sister, you are very fortunate that your sugar level returned to normal in time. Do you know what would have happened if Vaishali's sister did not attend in time?
Oh no.
See, your symptoms are reactions to over medication. You could have
Oh.
had a fatal fall if you did not lie down immediately. See, you are very lucky you were near the bed, and so immediately you lay down, isn't it? See, permanent brain damage and death can occur if sugar level does not return to normal in time. Follow?
But I understand, but madam, I tell you, my since my childhood periods, uh, I I always paid attention of my health. I don't like to sit idle and fall ill at home. So I took the high dose. जैसे when I have a cough and cold, I take extra dose of cough syrup to get better soon. And when I get fever, I take extra medicine to cure a fever fast. I
Always
do
do that.
these activities.
You always increase your medicine dose without consulting your doctor.
Oh yes, since from my childhood, because of the reason burden of study, burden of uh, because of the reasoning, I don't want to sit idle and
All right. And nothing serious happened till now.
no, no.
Okay. This is the first time you experienced, isn't it?
Oh, yes.
See,
Because
you are a
of the reason is I have a surgery, na gallbladder. That's the reason.
understand. See, you are a professor of zoology. So this means no, you have very good knowledge in chemistry,
Oh,
right?
yeah.
See, you must understand that medicine is a chemical compound used to treat or cure illness. See, medicines are classified in different ways. One way is to distinguish between prescription drugs from the over-counter drugs. Okay. See, prescription drugs are those medicines that you can purchase from a pharmacy only after showing a prescription. And those that you can buy without a prescription are called over-the-counter drugs. See, now just try to understand, sister, the drug development process starts with discovery of a new medicine. All right. First, the medicine is discovered. Then chemicals extracted from natural products are used to make pills, capsules, or syrups for oral use. Drug development includes preclinical research on microorganisms or animals and clinical trials on human beings. Follow? The final step is to obtain regulatory approval to market. See, this process can take a very long time. In most cases, an average of 10 years will pass between initial discovery of the medicine to full approval. And the clinical trial stages takes generally 6 to 7 years. Follow? So just imagine the amount of effort, money, and time that is invested before a drug is ready to be used upon human beings. So you cannot take any medicine whenever you feel like and however you feel like. See, this is very important. See, you must take medicines exactly as prescribed. If the instructions say take 1 tablet 4 times a day, please don't take 2 tablets twice a day. It's not the same. It will not work. So don't take more medicine than is recommended. It won't make you heal faster or it will not make you feel better quickly. Follow? In fact,
I
an
understand.
overdose of medicine can make you sick. And you have already experienced this very recently, isn't it?
Because of the reason that incident, I have learned uh, it become I have to die na if I do this.
Exactly.
My sister
Ah,
also angry with me, but my childhood period, I don't feel like this because of the reason I take more overdose.
okay. See, now that you understand, you will not take anymore. See, sisters, some medicines must be taken on an empty stomach. This is because food and drinks can affect the way these medicines work. Again, some medicines are taken with food to help lessen the stomach upset it can cause. Huh? So oral hypoglycemic pills are medicines to control diabetes. An overdose of diabetic medicine occurs when someone takes more than the normal or recommended amount of this medicine. Follow? The result is drop in blood sugar level that affects normal function of the body's organs. See, as you said, no, you were sweating profusely, you couldn't see anything, or your hands and feet became cold, isn't
Yeah.
it? So see, these are the reactions. The infants, children, and other older people develop more serious and long-term complications if blood sugar level does not return to normal level very soon. Follow? So the worst cases can make you feel disoriented, resulting in permanent brain damage and death. You are really very fortunate that Vaishali's sister was at home when you took overdose of the medicine and she attended to you immediately. Right?
Yeah.
See, another point you must remember is that you should never share prescription medicine with anyone else, even if that person has the same problem as you do. See, someone else's body may react differently to the same medicine. Maybe the person has an allergy to one of the components of the medicine, isn't it? See, after your gallstone operation, the doctor must have suggested antibiotics to prevent infection. So please note that you must take antibiotics for the full length of the time prescribed. Don't stop the medicine when you start to feel better. Okay. All the germs must be killed. Otherwise, the infection will come back.
Oh,
Follow?
yeah. Yes.
You know, sister, I know many people who take calcium supplements without the doctor's advice.
Yeah.
If you take a supplement more than that is required, your body has to do something with the excess calcium, isn't it? So do you know what happens? The higher calcium levels in the blood may trigger blood clots, or calcium may be deposited along artery walls, which can contribute to the narrowing of blood vessels. See, also when you take calcium supplements, you must take plenty of water. You must drink plenty of water. Otherwise, calcium gets deposited in kidneys in the form of crystals, which is called kidney stone.
Oh.
Follow? So see, every medicine must be taken as prescribed by the medicine, by the doctor. You said that when you get cough and cold, you take extra dosage of cough syrup to get better soon.
Yeah.
Cough syrup contains a chemical that is DXM. It is known as dextromethorphan. And this ingredient is found in many cough and cold remedies. You will find at least 120 common over-the-counter medicines which contain cough and cold, contain this ingredient. So it helps to stop cough. When it is used as per direction of the doctor, what happens? These products are safe and they work well. Okay. But the drug can also act as expectorant and help to break up congestion and provide temporary relief for running nose, watering eyes, and sinus congestion. When you take them in large amounts, it can distort awareness after and alter time perception. It can also cause hallucinations. See, Chronic use of medications containing DXM can lead to liver damage. High doses of DXM can cause blackouts or loss of memory. Some people experience rapid heartbeat, high blood pressure, and changes to breathing rates. Heart attack can also occur. Follow? With large doses, the brain can shut down. See, many medications with DXM also contain a pain reliever. So taking the medicine for several days can lead to liver toxicity. You also said when you get fever, you take extra medicine to cure fever fast.
Yeah.
Yes. See, medicine for fever is paracetamol. And paracetamol begins to work about 30 minutes after a dose is taken. And its effect usually lasts for about 4 to 6 hours. Paracetamol is taken by mouth and is available in various ways, such as in tablet, capsule, soluble, and liquid forms. So they will pass to the stomach and intestine into the body and lead to pain relief and lower your high temperature. Okay. After this, paracetamol is inactivated before being removed from the body. About 20% of the medicine is processed in the intestinal wall and the remainder in the liver. See, this may damage the liver. Paracetamol is the most common medicine taken in overdose, and it can lead to liver failure in a number of days despite using medication to protect the liver. And you know liver failure can be fatal. Sister, do you know that every year over 150 people die due to paracetamol overdose? Can you believe it? You said nothing serious has happened to you in spite of increasing your dose. Now you understand how fortunate you are really to have been saved from such side effects. Right?
See.
You said, see, you don't like to fall ill. You don't like to stay at home. You don't like to be idle. Right? So you want to get better fast and you take extra medicine.
Yeah.
But I repeat that medicines are chemical compounds. Right? They are chemical compounds. So used in the correct manner, they will heal us. But if used incorrectly, they will cause more harm. So in future, please don't take extra medicines. See, sister, even if we take too much food, what will happen? We feel uneasy, isn't it? We may vomit or we may get stomach upset, isn't it? So anything that is excess for the body will harm us. I also want to tell you something important. That is, our bodies are made to self-heal. So food acts as medicine to maintain health and prevent diseases. And there is a saying that prevention is better than cure. Isn't it? So you can reclaim your health by taking proper nutrition, including vitamins and minerals at the right time, in the right amount, and in the right way, along with proper exercise, meditation, and enough sleep. See, these help the body to repair and heal diseases. No. See, you said from childhood you have paid attention to your health. No, sister. Paying attention to our health means to keep ourselves healthy and free from diseases, isn't it? Yeah. But you only wanted to get well fast when you fell ill, isn't it? If you had looked after your health, no, you could have easily avoided gallstone formation by healthy eating and regular physical activity to maintain a healthy weight. Are you a vegetarian or a non-vegetarian, sister?
Vegetarian.
Okay, very good. See, healthy eating means we must eat food that are high in fiber and low in fat. Okay, high fiber food means raw fruits, vegetables, citrus fruits, leafy dark green vegetables, cooked beans and peas, whole grains, tomatoes, low-fat milk, brown rice, oats, and whole wheat bread. See, olive oil is also good for health. So a high fiber, low fat diet helps keep bile cholesterol in liquid form. See, gallstone is nothing but deposits of solid cholesterol, right? So food containing too much cholesterol must be avoided, right? So you have to avoid butter, ghee, cream, hard cheese,
I
fried
like
food.
this much now.
Yes, but if you want to stay healthy, you have to avoid them, isn't it? Fried food, cakes, biscuits. Avoid refined carbohydrates, take less sugar. See, the major causes of gallstones are high cholesterol diet, obesity, family history, and vitamin B12 deficiency. Follow? See, but what's done cannot be undone. So I shall suggest that in future, you pay attention to your food habits. Okay. See,
Definitely.
you stay out of home from 9 a.m. to 7 p.m.
Yeah.
Do you carry your lunch or do you take food in the college canteen?
Sometime I take from that canteen.
Okay, okay. See, what happens? The gallbladder collects and concentrates bile, releasing it when you eat to help the digestion of fat. No? So the function of gallbladder is to digest fat. So when the gallbladder is removed, see in your case, there is no gallbladder now. So what will happen? Bile is less concentrated and drains more continuously into the intestine. It will not collect in the gallbladder. No. So now you must avoid high fat foods, sugar, and refined flour. See, fatty foods include butter, cooking oil, fried food. Sugary foods include chocolate, cookies, candy, cakes, pastries. No, they are very tasty,
Yeah.
but stomach will not tolerate it. So food made with refined flour include bread and pasta. Also, you must avoid caffeine.
Oh,
Right? Do you take tea or coffee?
yeah. I
Yes,
like
no?
without it, it doesn't do the work, na?
Exactly. So when you're tired, what happens when you take tea or coffee? No? You feel less tired. Yes. See? Besides what happens, your glucose level is a little high, no? So if you take these precautions, your blood sugar level will also be at the optimum level. So be your own doctor, keep yourself healthy and free from diseases by paying attention to your food habits and lifestyle. See, avoid outside food as much as possible. You said no, you have it in the college canteen. See, sister, food is cooked outside in a very unhygienic manner. They don't wash the vegetables, they don't wash the utensils. And also, they reuse leftover oil. And this is very bad for our health. So carry your lunch. See, you can take fresh fruits, dried fruits, sprouted grams, boiled vegetables. See, instead of tea and coffee, you can take fruit juice, lemon juice, coconut water, isn't it?
Yeah.
Definitely.
Exercise,
sister? Do you do exercise?
No.
You don't have time for exercise. See, but in the holidays, take regular walks. Walking is a very good exercise.
But I have no time to walk along this.
Pardon?
I have no time na to walk.
During holidays, sister. In holidays?
It means to sleep for a long time.
Even then, see, I'm not saying that don't take rest. In the evenings, you can take walk, right? But take walk before sunset. All right. You know why? Because plants take in oxygen and we also take in oxygen after sunset, right? But before sunset, what happened? Plants take in carbon dioxide and they give out oxygen. So what happens before sunset? Oxygen content in the air is more, right? And after sunset, because we are giving out carbon dioxide, plants are also giving out carbon dioxide. what happens? Carbon dioxide content is high. When do you go to sleep, sister?
Around 11
When do you
p.m.
wake up in the morning?
7 a.m.
7 a.m. See, you need, that means 8 hours of sleep, isn't it? So when you wake up, you are fresh.
But I have lot of burden of my college papers, theories, making notes.
So see, you go to sleep early, then you'll be able to wake up early. No, in the mornings, the air is fresh. So when you do work, no, that is much more effective. Right? So minimum 6 hours of sleep you must take. So try to go to bed early so that you can wake up early. All right. So see, if you are ill, take your doctor's advice and follow the instructions as given. Don't become your own doctor then. Okay. See, you are a professor, no? So share your experience among colleagues and students and spread this awareness among your students and colleagues. So this is very important. See, this is not the only case with you, sister. Everywhere people are taking excess medicine without knowledge. They think they will get cured fast if they take extra medicine. No. See, whatever food you take in 2 days, can you take it in 1 day? It will be of no use, no? You will vomit out the food, right? If you take 2 days food in 1 day, what will happen? You'll just vomit it out.
Oh, my stomach
Right.
was over, and even I one bite couldn't take, na.
Exactly.
How to take this?
Oh, see, this way, medicines also, if you take too much medicine, it will not work. It will only harm the system. All right. So I hope I've been able to convince you, sister.
Oh, yes, definitely.
Yes.
My eyes are open when I meet you and listen this, because my fullness, and I thank to my Vishali sister who took me
Exactly.
he scared me and it took me to ki, if I do this, what will happen? And I
One day
promise
you will be in trouble.
to my sister I never do this again.
Shani, sister? Sister, you are mute. Are you convinced, sister?
Yeah.
Okay.
Yes,
So
ma'am.
I'm sure Rakhi sister will not take extra medicine anymore.
Oh,
And
yes. Promise to
Rakhi
you.
sister, do you do meditation?
No, I don't know how it is done and what is this.
Vaishali sister, do you do meditation?
Hi, yeah.
Okay. See, have you heard about the Brahma Kumaris?
Yes, ma'am.
Rakhi sister, have you heard about the Brahma Kumaris?
No, I don't know, and I don't interfere in my sister's life what she's doing. Um,
No, it's not a
but
case of
if you told
interfering.
Brahma Kumaris, I asked to her, what is this?
See, at the Brahma Kumaris, no, we learn to lead a very healthy lifestyle. So we learn Raj Yoga meditation, and we do meditation daily from 4 a.m. to 4:45 a.m. So if you start meditation at 4 a.m., that means you have to wake up earlier. Exactly. And that means you have to go to bed earlier, isn't it? Right?
How I wake up?
You have to sleep early then. No. And you know, when you wake up early, you get so much strength, so much energy that you will feel like waking up early. Okay. And see, we go to the center and every day for 1 hour, we learn spiritual studies, right? So there are different times in which classes are held. You may attend whenever it suits you. So I would suggest that both of you go to the center near your house and learn meditation. See, 7 sessions in 7 days are offered at all centers, and it is absolutely free of charge.
Oh,
And
definitely.
you can remain associated with it for lifelong, right? And
I,
also, meditation makes you positive.
hmm.
Your body will feel stronger and more energized.
Oh,
Follow, sister?
yeah.
Hmm.
I will try to go and search this center, and I go there and do the meditation.
Help you.
What is this? How to do this? I follow this.
Shani, sister, do you go to the Brahma Kumari Center?
Yeah, ma'am.
Okay. So one day you take your sister along with you, okay?
Okay, ma'am.
Then she can also learn meditation, right? Then she'll be positive minded. She will get much more energy. She will be stronger. Okay. All right. Thank you, sisters. Thank you, Vaishali sister. Thank you, Rakhi sister, for attending the session. And I am sure you will never make a mistake again.
Oh, definitely. I promise to you. God promise. Because of if I my fullness में मेरी मैं ना ऐसे हो गई हूँ कि what I have do in the past. So I thank to my sister and to you. You have to uh, start me how to live, how to take my good food, exercise, meditation, and I follow your instructions. And I call you back. Ki, what improvement I have in my
Okay.
life.
Yes. Thank you very much, sister. I'm very happy that you have at least
Thank you.
understood. No, so next time, take your doctor's advice, call the
Oh,
doctor, and take the medicine. All right,
oh,
don't
definitely.
take it at your will. Okay,
Thank you.
thank you very much.
Today's topic was create the awareness with the patient that why they shouldn't take the medicine without consulting the doctor. Because sometimes it happens that when doctors prescribe the medicine, then next time the patient falls sick, then they try to become their own doctor and they use the old prescription also. And also it is noted that maybe that they go to the doctor because sometimes in India, especially, some chemists give the medicine without asking for the prescription by doctor, which is very dangerous and can be very fatal for the health of the patient. So this was to create the awareness that why we shouldn't take the medicine without consulting the doctor or a pharmacist. There are many side effects of the medicine which can be very fatal, like skin irritation, dizziness, headaches, then certain medicine, if taken together, can interact with other medicine, and also sometimes organ failure is also there. So this is the case of a young patient who was treated to the gallbladder, and he has taken the overdose of the medicine, which has got like many side effects. So the patient was advised that she has to be very careful and medicine only which is prescribed at that as per the recommended dose, not more or less. Should be taken at the right time and as per the uh, advice of the doctor. And we know that nowadays certain people don't go to the patient don't go to the doctor, they go to the Google and they find out which medicine to take, which disease that also can be very harmful. Because it is not written that what quantity should you take, and we know that for one medicine there are different companies are there, the same kind of medicine, but sometimes we need to be very careful that which company's medicine is the good for the patient. So uh, it is very convenient sometimes for the people that they think that they can discount, but medicines are can lead to very problems, many complications, and sometimes organ failure also. Well, it is not like don't take it very lightly and think that uh, if somebody else is taking the same medicine, so the same disease, this will help to other patient also. So if everybody's body is different, and only doctor can be the proper guide that why this medicine is suit, and before giving the medicine, doctor also, if the patient has got any previous history also and allergy, if there is allergy is there, but if it's a particular medicine that we also not advise. So uh, this is the case where the company has come to our sponsors, and the case was decided that it was told the patient that which she has to be very careful. Uh, as we know that when somebody is operated, then uh, medicine has to be taken for particular days. The doctor is the right person to advise that how many days we have to take the medicine and what quantity will be the right one. So that we should continue with the prescription. We should always be in hand and not forget that it should be there available with us. And if we have any confusion, we should definitely consult the doctor. Again, any reaction is also there because sometimes the doctor gives the medicine, but they don't know and what is the his past history of the patient. So if any other is there, that also should be informed. And after taking the medicine, if any reaction is there, any side effects are there, for a doctor, maybe that he will change the medicine or maybe that he will reduce the dose of that medicine also. So the session where they have to create the awareness among the people that it is not that easy that any medicine will be suitable for anyone. And we can take the medicine in any amount we want. Especially the medicine like which are very like for BP and sugar because the fertile organs can be there, the patient can go on coma also, the disease can be there, or they can be very side effects. Thank you very much, Sister Kulupali, for conducting this activity that only uh, like doctors which are specializing in that proper kind of disease should be consulted, and you should not go to anybody else who doesn't have the proper like degrees for this kind of struggle. And especially this allopathy is very important because these medicines are very strong and sometimes the side effects. Session was YouTube was very good. Uh, Once again, we are thankful to all the today's participants. This is the demo counseling that is to confident spiritual health, specifically the awareness of how important is to the patient's health. If the medicine the right quantity of the session comes from the to others.